At BOPA, we founded our Equity, Diversity and Inclusion Subcommittee last year in January. And we did that with the understanding that there's a lot of work to be done in this space. And so what we did was, the first thing that we did is we wanted to understand the needs of our members, so understanding the needs of the workforce. And upon conducting a literature search, we realized that nobody has done this. Nobody has asked healthcare professionals about their experience in the workplace, about any microaggressions, any bullying. Do they feel that they have equal opportunity for promotions and opportunities? And so we designed a survey and we sent it out to our members. And the results were not surprising, because we knew that these things happen. We know that there's systemic racism in organizations, but we didn't know that it was going to be to this extent. From the people who participated in the survey, 50% indicated that they have experienced one form or another, some form of discrimination. And then, so the discrimination could have been microaggressions within the workplace, or it could be not being offered equal opportunities to either promotions or to training that's available, or collaborations that are accessible to the department. And then we got very rich data also from the open comments. So the participants were very happy to share their lived experience, which some were very distressing to read about. So from this data, we decided then to start a work stream where we support, educate, and train workforce, so that to promote a more inclusive environment for all. So for us at BOPA, we don't have we cannot influence, if you want, what happens in the members' workplace, because we are external to that. However, we can set an expectation, is that as an oncology pharmacy organization, we believe that all employers should provide an inclusive environment where employees can feel that they are offered equal opportunities, that their circumstances or their characteristics are not putting them at any disadvantage for career progression or anything like that. So there's a lot of work to be done. So we're going to start off designing some cultural competence and humility training that we're going to offer to our members. And then, so that work stream is to support the workforce, if you want, and there's a lot of work that needs to be done. The other stream of work as well is, how do we provide inclusive care to patients? So at the moment, the way we've been trained as healthcare professionals is to treat everybody equally. But we know that this is not the most effective approach. People have different needs, and you need to be able to individualize your approach as a healthcare professional based on people's needs. So, for example, people that are neurodivergent, they are going to need counseling in a different way. If somebody has, let's say, belongs to the LGBTQ plus community, again, they're going to have different needs in their counseling. You need to use preferred pronouns. You need to inquire differently about their circumstances. One size does not fit all. And by individualizing the approach to care, then everybody will feel included and nobody will feel excluded, because that's what the evidence at the moment tells us, is that people with protected characteristics, they often feel on the outside of the system. So because the training of healthcare professionals is so stereotyped, if you want, and it's with the approach of one size fits all. So we now know that this doesn't work. And so we are investigating how we can individualize our approach to make all patients feel included in care. So we did a piece of work, again, part of the committee, where we spoke with people of ethnic minorities, and we asked them about their journey in cancer care. So we just wanted to understand what was their overall experience. and what were the successes, what were the failures, what was their frustrations. We recognize that the cancer journey is a very difficult journey. But if you add a layer on top of it where people feel dismissed, or people feel judged, or people feel not seen, or their voice not heard, that then compounds the experience into a much worse journey. And so the interviews that we did were with participants from different backgrounds of ethnic minorities. And the themes were very were very interesting. It was an interesting insight and also distressing at the same time, where some people felt very dismissed by their healthcare professionals. They felt that communication was very weak. So at some points they did not understand what was going on with their disease, whether it was controlled or not, why they were being offered that treatment, and they were too intimidated to ask. And I don't think any patient, while going through the cancer journey, should feel intimidated to ask and to follow up, or even to ask for amendment in the treatment that they're offered. But oftentimes that voice is not heard, and the patient is so intimidated by the system. Everybody's busy. Everybody's overwhelmed, so they don't want to add a burden, but at the same time, it's unfair for the patient to feel, to suffer in silence, and not to ask for little adjustments that might make a big difference to their journey. So again, that piece of work was very enlightening, and that leads us further to the idea that healthcare professionals need to be trained differently, and we're hoping that we can influence undergraduate curricula, so at the beginning of how healthcare professionals are trained, but also after they graduate as a continuous professional development. How can we make sure that the next generation of healthcare professionals are inclusive in their approach, mindful of the various characteristics of the patients in front of them?